My father died of a massive heart attack. He got no warning. He was complaining of a pain in his chest one evening there. He was 57 years of age. People said you should slow down a bit. One day you'll get a stroke and fall down, you know. I'm supposed to be getting older now, so more conscious of it now at the moment. And I have my son at home and he doesn't expect me. I just do what I want to do, and at least I'm winding down.
The cardiovascular health status of Irish farmers is a cause of concern. Irish research showed that farmers and farm workers in the working age from 15 to 64 have 7 times higher mortality from heart disease compared to salary jobs. Our evaluation of the Farmers Have Heart cardiovascular health program showed that 74% of farmers have 4 or more risk factors for heart disease, placing them at a 3-time higher risk for an acute cardiac event. Heart disease is not only a health risk, but farmers with risk factors for heart disease also are at higher risk for safety issues.
This is a dairy farmer in Portlaw, County Waterford. We're making just around 200 cows here, but at the moment I'm handing over to my son Shane. So Shane is coming 35 years of age and he just got married there last December, and his wife, they're all very involved in it. So I'm probably one of the lucky ones on the farm at the moment. So I just do what I have to do, so all the stress and that has gone out of my life. I got notification that they had clinics in the co-ops or the mart, something that way. So then myself and Bernie, my wife, spoke about it, and she said we should go down, and and I said why not? It was a free service, and if they found anything then we'd made me more conscious since then to follow up. There was no stress to come in. They took all details, whatever my age, different things that way, and then whatever I took the blood samples, different things, and just explained the different types. Say with the cholesterol, I eat too many sweet things and I do things I shouldn't be doing maybe, yeah. But I still do it. But now I just take a tablet every day or something for that. My wife will probably go more regular than I would, which women are better. They say that men are more culprits, especially when you're on a farm. You're prioritising other stuff. But but since then, yeah, I go regular, yeah.
Heart attack, strokes.
You mean under
the age of 60?
No.
Nothing. And diabetes? No. Okay, perfect. Right, that's good. I'll check your blood pressure. Can I do your left side?
This side, isn't it?
Yeah. Now, so how would you consider your diet?
Bad.
Don't be so honest.
You don't even look.
Is it?
No, I've not.
Now, just keep the hands straight. Yeah. In what aspect now? Tell me, what would you eat a lot? Do you eat fish? Let's start with fish.
No.
Stress is a massive factor, so they need to check that their blood pressure is okay. Everyone should have their annual cholesterol checks. It's very important towards prevention more than cure. And oftentimes then with heart disease, and we see it every day, the symptoms start developing and then often it's too late.
Knowing is always better than not knowing. And if you're the type of guy or person that wouldn't go to the doctor annually, to pop into a room like this for 3 or 4 minutes, the amount of information that you can get together, maybe it can get you thinking. When you're on the way home in your tractor, your Jeep or your car, you might be analysing what happened in this room, and it might encourage you to go to the GP or maybe seek an appointment with a cardiac type person or whatever, So, yes.
I was in hospital for a week, and the first time I went in, when I landed into casualty, the 226 over 118 came up on the screen, and I said to the lady, because I wasn't familiar with the blood pressure spikes at the time, just wasn't, because I had no need for it. I said, "Is that high?" She said, "You're going nowhere." And I said, "Oh." So at that, it got serious when I had 6 doctors around me and they asking me the various questions. What symptoms did you have? Why X, Y, and Z? I had no symptoms, and what I'd like to say as an experienced person from this, and I've learned a lot since and researched a lot for myself, that tiredness is one of the big symptoms. It's actually possibly more genetic, because my dad had a heart attack and had 5 stents in 4 years ago. So when I was in the hospital with him, meeting the cardiology doctor, and we were sitting down and we were speaking, it was only then I realised his father had fell dead at home with a heart attack. So it is genetic. I didn't know that, but when I was in hospital for the week I was in, nobody told me this. You know, something needs to be, more funding needs to come over here, that there's more health checks, especially at the mart. Say our mart is on once a week. Now I wouldn't expect a health check to be at the mart once a week. That'll trigger our farmers as well when it's advertised up on the board. God, that health check is here now next week, I'll come back next week and I'll do it. And the connectivity between farmers, it rolls on, because if one does it, well sure, maybe you're doing it, I'll do it.
I think farmers like to chat, so I think it's really good if the local nurse knows something about the locality, maybe knows something about the country, knows something about farming, to make them feel at ease.
A lot of our nurses have been doing the programme for years and years and are very loyal to who they see and also to the Irish Heart Foundation, and I think that really transcends in our approach. I think it's quite personal for a lot of the nurses to go to their areas and look after their community. So it's very community based. That's why I think it works basically.
They said I probably should be doing more exercise. Like, okay, I said I'd be going around the farm every day, but that's not, they said that wasn't enough. You want to be doing, say, a walk, maybe a mile or two, kind of, you know, at a little faster pace.
I actually feel better now at 55 than I did at 40. Phenomenally way better. And that's down to, you know, changing a few things, like, you know, go get your hair done, get your nails done, needless to say the colour of my hair, but anyway.
Like other programmes that have been supported across the Department of Agriculture and other initiatives like the Farmers of Hearts, you've got Fit Farmers programme, and you have our Irish Farmers Association, which is the Farmer Health Check programme. All these initiatives are offering full health services in rural communities, in rural settings. And I think what they're all interlinking, like they are offering assessments, they're offering free advice, they're offering education, and they're offering professionalism, and they're offering a service in a setting where farmers are actively found each day, either if it's in a mart setting or it's in a rural environment, or it's where we're bringing the services to the rural community. Farmers Have Heart Cardiovascular Health Programme is a programme that can be replicated. It can be replicated to reach other farmer subpopulations, it can be replicated to reach other sectors or to other countries. Key factors for programmes like this are a multi-actor approach. So we worked together with farmer organisations, agri-food industry, health services, and health NGO and researchers. Another key factor is working evidence-based, implementing approaches that are based on best practice. And finally, very important is to develop strong engagement strategies which are relevant to the target group you want to work with. And you can think of elements like a personal approach, gendered approaches, and strength-based working methods.
Look after your health anyway. You get your car serviced every year, and you look after your tractor, whatever that way, but your own health is more important, I think. Yeah, so don't ignore it.
It has saved people's lives. It saved my life.